Casey, yeah, so 19 more families and groups of friends are dealing with the loss of loved ones in Victoria because of COVID-related deaths. Has this come as a bit of a surprise in terms of the numbers of daily deaths that we've seen in Victoria over the past month or so?
Yeah, definitely, Joe. I mean, 19 more deaths being reported today. I think we would have all hoped that we would be well past, let's go to the deaths, well past the sorts of numbers like 19 that we've seen in a day. And if you can see on the chart here, this is all of the deaths in Victoria back to the middle of the year. This is the second highest day of this wave that we've seen. There was a day with 25 deaths, and it's a bit of a surprise because really things have been improving on all fronts, basically. This number of deaths have been trending very slowly downward, but at least it wasn't worsening. It was sitting at about 7 or 8 and has been there for quite some time. If we have a look at the hospitalisations, they too have been trending downward on all fronts, both hospitalisations, ICU and ventilation. If you have a look at the 7-day average of cases, well, that has been flat, slowly trending downward, but certainly not a rapid escalation that would lead to 19 deaths. So, you know, we do need to know a little bit more about what these deaths are. We would certainly hope 19 deaths will not be a sort of number that we'll see repeated in the days ahead. One of the possibilities could well be that these are not 19 people who have necessarily died in the last 24 hours, but they are deaths that are only just being reported now. And Victoria has done this a couple of times in the past where, for various reasons, deaths have either gone into, you know, deaths may have been reported but not reported as COVID deaths, or, you know, for some reason, people have been missed and not reported through the daily mechanisms. That may be, I'm not saying it is, it may be one of the factors behind this big number today. We need to learn a bit more about what's happened here from authorities. It could also just be unfortunate and sort of a particularly bad day. Maybe this virus has swept through a cluster of vulnerable people, you know, in the recent past, and that has led to this. But given the general trend line has been, you know, stability, slow improvement in Victoria on all other measures, hopefully we won't see this sort of number repeated again in the days ahead. I hope, fingers crossed, you know, but of course we've seen that this virus is can be erratic, can be unpredictable, and of course it's a useful reminder, Joe, that we are still seeing nationally more people dying of COVID-19, even though people are, you know, out and about and moving around more and getting back to some level of kind of living their lives out of lockdown. We're still seeing more people dying on a daily basis nationally than we would normally see from, you know, respiratory flu-like diseases on a normal year. So those numbers do still want to see them come down.
But conversely today, the case numbers that have come through for Victoria are relatively low considering what's happened in Victoria over the past couple of weeks.
Yeah, less than 1,000 cases today, 827, and we've seen this picture of you know, sort of stability and a slow decline for about 3 weeks now. Victoria's got a pattern where the sort of early part of the week tends to have lower numbers. The back half of the week from about Thursday tends to see an elevation from people getting tested midweek, perhaps after being infected on weekends when they're interacting with other people. And that has been the pattern for some time, but the general sort of pattern has been a very slow decline. It's forming some sort of stability in the same way that New South Wales has. If I show you the New South Wales numbers, the difference being though that the New South Wales numbers have found some level of stability at a lower level. So Victoria's still got a way to go to bring those case numbers down. Because it opened up with more infections a day, we would expect it just will take a bit longer for us to get there. New South Wales, by the way, has been remarkably stable now for a good, well, basically the entire of this month. I don't think it will stay that way forever, but it's, you know, holding up pretty well at the moment while vaccination coverage continues to slowly increase. We're kind of reaching the limit of that now, but the second doses are still increasing, while the sort of average is sitting at about 200 cases a day.
Yeah, and so Casey, why is it the case that numbers going through the roof just didn't happen in New South Wales? We heard the former Premier Gladys Berejiklian when she was talking about the state opening up again, and we should expect that those numbers were going to go through the roof, daily case numbers, once the state started opening up. Why didn't that happen in New South Wales?
That's probably a question a much smarter person than I will have a much better answer for. But I think we're still expecting that will happen at some point. You know, it's unlikely you'll keep case numbers sitting at about 200 forever. You know, I think we're still expecting that will be a sort of exit way, particularly as you know, more and more unvaccinated people start interacting and you know, engaging the community from mid-December. Now, there aren't very many unvaccinated people, but